Don't let your first symptom be your last. I hear this all the time. People have a heart attack or a stroke after being told that their labs were normal. And that's why heart health is about so much more than just cholesterol or a stress test. Hi, I'm Dr. Myra Reed. I've been practicing internal medicine for over 30 years, and February is Heart Health Month. What I want to talk about today is something I wish more people understood earlier, because heart disease rarely starts with just chest pain. It starts quietly, years earlier, before symptoms ever appear. For decades, heart health has been reduced to one number, cholesterol, and often one solution. Sure, cholesterol matters and statins have a role, but cholesterol is only one piece of a much bigger puzzle. I've seen patients with normal cholesterol, reassuring stress tests, no warning symptoms, who still had significant vascular disease like a heart attack or a stroke developing silently. Most routine heart tests is designed to detect advanced disease, not early disease. Stress tests usually don't become abnormal till arteries are already significantly narrowed. Standard labs can miss early plaque formation, inflammation inside the lining of the walls, insulin resistance, hormonal and metabolic drivers of vascular disease. This creates a false sense of security, and unfortunately, that's often when people are caught off guard. In preventative and longevity-focused care, we ask a different question. What's happening now, before symptoms appear? That's where tools that look like the carotid artery ultrasound. This is a very advanced ultrasound of the arteries of the neck, the arteries that are going up to the brain where strokes occur. What we do now is we have an advanced ultrasound that actually will go in and measure the lining of the artery in the walls in millimeters where the plaque starts forming. And not only can it start seeing the plaque, but it can measure in those tiny little millimeters and see if it's stable or unstable. Is the plaque hard or is it soft? Because the soft ones are the ones that can trigger having a stroke. So wouldn't you want to look at that earlier and see if you're at risk for having something that can be prevented or caught early? Because once you know earlier, know what's going on, then you can do something about it earlier. We have all kinds of tools in our tool chest that can actually help reverse vascular disease instead of just waiting till boom, something bad happens and then trying to fix it and reversing it when it's in the later stages. Early detection is so much more important. We also can do things like looking at the heart. We can do calcium scores. And if you have a lot of plaque around the heart, you see calcium build up by doing this calcium score, the CT scan, then we can do something even more in depth. That's what we call an advanced plaque analysis using this AI machine called Clearly. And it can be very invaluable in looking at not only if there's calcium, but if there's inflammation, if there's plaque, is it unstable? And if so, we need to get with it. There's things that we can do. There's so many different things that we can do to be proactive and reverse and prevent before something bad happens. These tools can identify these early plaque and these vascular changes. And this is something that we just don't see in regular testing like an EKG or an echo or just a stress test. Let's look earlier and catch things earlier. So this is really important to understand. You can have normal cholesterol, normal blood pressure, normal stress tests and EKGs, and still be developing heart disease. So why? We need to really start looking at heart disease and what's driving it. It's just much more than just cholesterol. It can be things like chronic inflammation, insulin resistance, poor sleep, this chronic stress, hormonal changes, loss of muscle and metabolic health. If we don't look at these drivers, we miss this bigger picture. So I want to say prevention is not just testing. Early detection is very powerful, but it's only part of the strategy. True heart health also depends on strength training to preserve muscle, cardiovascular exercise without overtraining, quality sleep, stress resilience, hormone balance, reducing inflammation, supporting metabolic health. It's never just one lab. It's never just one pill. It's never too early to start. When heart disease is identified early, it's often modifiable. Lifestyle changes are more effective. Medications can sometimes even be minimized or even taken off. Quality of life is preserved, but once diseases advance, options narrow. That's why I'm so passionate about early detection and prevention. So this Heart Health Month, I want you to remember this. Heart disease doesn't usually start with chest pain. It starts quietly, years earlier. Advanced early detection is key. So don't let your first symptom be your last. If your goal is to stay active, sharp, and well as you age, early detection and a smarter prevention strategy truly matters. If you want to know more, join us to learn more about how we approach heart health prevention and aging well. This is the philosophy at the core of my Smarter, Stronger, Longer approach.